To achieve the development and establishment of the Mount Gambier In Home Hospice Care service, a steering committee was established initially with Sandy Elliott, the CEO of the private hospital, as the project manager, and myself, Maureen Klimberg, as the chair of the committee. Our task being to develop a blueprint, action plan and timeline to achieve our goals. Our highest priority was to train the network of volunteers who would provide the 7-day-a-week, 24-hour care to patients approaching end of life in their home environment, to provide respite for carers and family. It is anticipated that our team of trained volunteers will commence working with their first clients in early June. The care will be collaborative in partnership with the palliative care unit, local GPs and allied providers. We are now an incorporated body. The Board of Governance, we advertised for board members and have appointed 8 board members that include Sandy and myself. We're delighted with the skills of the members of the board. They will be responsible for the governance and management of the organisation, future development and education. The journey over the past months has highlighted to the community the importance of the discussion around palliative care. It has also provided us with further information about the gaps in services. As we are using Warrnambool District Community Hospice as our model to develop our service here in Mount Gambier, we were challenged with COVID, but eventually in March we were able to organise a community forum with the Warrnambool management team travelling over and speaking on the night. They then held discussion groups the next day involving the palliative care unit, other service providers in the community, and most importantly, people within our community had the opportunity to come and listen if they were interested in becoming a volunteer. As a consequence, we were delighted that we were able to register 18 potential volunteers. They are now undergoing training through the Warrnambool team via Zoom. The hands-on component of the training will be offered locally through a partnership that has been developed with Flinders SA. During the time also, we have established a premises for day-to-day operations of the service, appointed a part-time volunteer coordinator, Jane Shepherd, part-time hospice manager, Sandy Elliott, and they are now responsible for the development of all of the materials and resources for our volunteers. They have compiled the volunteer manual and the training module manual